problem in decades, but now there is growing concern due to a series of measles outbreaks across the U.S.
Yeah, the country has seen at least 3 major outbreaks recently. The most recent in Texas, where it has grown to 58 cases.
We're joined today by our KRDO 13 medical expert, Dr. Neha Sharma, to explain more about the disease and why these cases are showing up.
Yeah, we're thinking this is almost an antiquated disease, but not the case, really. How is this possible, and why is this now coming up into our latest point of view?
So 25 years ago, we had eradicated measles in the United States. And that was because of our vaccination efforts and the drives. But now with the anti-vaccination sentiment coming back, there is reintroduction of measles, which is leading to these surges and cases rising. And also with all the international travel. So if an unvaccinated person is traveling, contracting measles, they are bringing it back to the U.S.
So should we be concerned that measles could spread to Colorado as well? The next outbreak would be here. How is it spread? What can people do to avoid that?
That's always a concern. You know, hard to say if it's coming to Colorado. Right now, there are no cases in Colorado, but the spread is always in concern. It's spread through respiratory droplets, so coughing, sneezing. So remember to always cover that cough and sneeze and wash your hands. And get vaccinated. That's the only way. It's a preventable disease, highly contagious, but preventable. And if you're an adult and you're not sure that you got the vaccine, talk to your doctor, because you can still get the vaccine series.
And speaking of vaccines, we have seen a resurgence of influenza A, stomach bugs, things of that nature, and hospitals are full, in fact. You want to touch on that too, and the vaccines and how they play into that.
Yes, flu A is on the rise. Hospitals are full indeed. Patients are on oxygen because of it, especially the immunocompromised patients. Get your vaccine. The flu vaccine especially, get it. And you know what, I'm not saying that if you get the vaccine, you're not going to get the flu. Right. There's still a possibility. But if you are vaccinated and you get the flu, you're going to recover faster, and your risk of getting hospitalized is definitely lower.
In the break, we were talking about strep throat as well. You're seeing a lot of cases of that. Is that something that you can get vaccinated for? And if not, what could you do to avoid that? Because in adults in particular, that is nasty. Kids a little easier, but adults, it'll put you out of commission for a while.
It is, and unfortunately, there is no vaccine for that.
Okay.
It is also contagious. So if there's a family member that has strep in your family, make sure you're not sharing anything. After you recover from strep, get rid of that toothbrush. And for strep, they usually prescribe antibiotics for 10 to 14 days. And you make sure that you complete that antibiotic course. Even if you feel better after 2 days, you must complete the antibiotic course, because strep is a risk factor for getting rheumatic disease, which can affect the heart, kidneys.
Oh, wow. And how is that spread, strep?
That's also respiratory or sharing liquids.
I see.
And you're seeing people in the hospital for strep these days as well?
Some adults, yeah, they are hospitalized for strep as well.
It's pretty serious.
Yeah, it is.
Kind of a triple threat right now facing us,
yeah.
even if we don't have measles in Colorado, but hopefully that stays the case.
I know, right? Fingers crossed.
Yeah, Dr. Sharma, thank you so much for coming
much.
in. By the way, if you have any questions for her, you can send those to us, healthycolorado@krdo.com. Thanks.